Osteoarthritis occurs when the smooth cartilage joint surface wears out. Osteoarthritis usually begins in an isolated joint, while rheumatoid arthritis is an autoimmune disease, which means that the immune system malfunctions and attacks the body instead of intruders. Hello everyone, welcome back to Ifechi Health and Wellness. I know that I promised to talk about the foods that we should avoid when someone has arthritis, the food to avoid. Due to some of the questions I received when I uploaded this video talking about osteoarthritis, I want to talk about the difference between osteo and rheumatoid arthritis, and then the next video will now cover the foods to avoid, and then after that I'll also cover the foods to eat more of to help. I wanted to just go on to talk about the food, but let's just explore this further to know the difference between these two and how it can affect people before we go into the food. Okay, people usually ask, which is more serious, osteoarthritis or rheumatoid arthritis? I got that as a question. So osteoarthritis usually affects fewer joints, and its symptoms are generally limited to the joints. The progression of rheumatoid arthritis is more difficult to predict, and it can cause more widespread symptoms. The outlook for people with rheumatoid arthritis has greatly improved due to advances in research and therapies. Then, the next question we need to look at when we talk about this arthritis are, what type of arthritis is the most painful? Rheumatoid arthritis can be one of the most painful types of arthritis. It affects joints as well as other surrounding tissues, including organs. This inflammatory autoimmune disease attacks healthy cells by mistake, causing painful swelling in the joints like hands, wrists, and knees. And can you identify or diagnose rheumatoid arthritis by going for an X-ray, or what other kind of investigation can you do to diagnose rheumatoid arthritis? Yes, you can actually do X-ray, because joints in rheumatoid arthritis look different than the joints in osteoarthritis. That is why X-rays are helpful. They are a very helpful tool for figuring out the cause of the joint pain. So on an X-ray, there is less space between the bones in osteoarthritis than in rheumatoid arthritis. So when they do the investigation, they will be able to actually identify which type of arthritis you have, although blood tests also will show that the person has osteo or rheumatoid arthritis. And the other thing to look at is whether rheumatoid arthritis or osteoarthritis are considered a disability. Well, here in the UK, we have what we call Equality Act 2010. Rheumatoid arthritis, most of the time, obviously, people are placed on medications, and without that medication they cannot function. And some people with osteoarthritis as well, not everyone, but some people with osteoarthritis, depending on how disabling it is and how it affects their day-to-day living and the level of medication that they have to take, and without that medication they may not be able to function. That's when you have to consider whether this can be covered by as a disability. Not everyone that has osteoarthritis in particular will be classed under as a disability. So it's not one size fits all. It depends on how you're presenting and what your symptoms are. And as I said before, for rheumatoid arthritis, your doctor may will have to arrange like blood tests to help to confirm the diagnosis. That's for rheumatoid arthritis. Although no blood test can definitely prove or rule out a diagnosis of rheumatoid arthritis, but having a test can show indication of the condition, and then various other investigations like X-ray and so on will now confirm it. So it's very important when you have pains, because some people who are younger, when they have pains, they think that, oh, it's something for older people. So it's very important to know that this can happen at any time, especially in these days when people are eating so much rubbish. So we have to make sure that you check things out to know whether it's actually arthritis that you have or not. And as I say in my next video, we are going to now talk about the foods to avoid. But there are so many foods we are eating and we think they are good for us, but obviously they may be good for us, but if you have certain conditions, then certain foods may not actually be good for you. So in the next video we are going to talk about that, but let's just talk more about the difference between these two. There's a question that also came up, which is whether it is true that women have arthritis more than men. For one thing, women's tendon move around more because, to accommodate childbirth, they are more elastic and also prone to injury. Also, women's wider hips affect the alignment of the knees in a way that leaves them more vulnerable to certain types of injuries, which can translate to more arthritis down the road. So the answer to that question is yes. And not only do women get more arthritis than men, 1 in 4 compared to 1 in 5, but women also often experience more or worse pain and ache in different joints and are far more vulnerable to rheumatoid arthritis, one of the most disabling forms of condition. Yeah, I think this is true actually, because some of the people I've dealt with rheumatoid arthritis were mostly women. Yes, so this is the reason, what I've just said now is the reason why women tend to have this more. The most important risk factors for osteoarthritis in women as in men is obesity. So when you lose weight, when you're very overweight, it can actually, predispose you to osteoarthritis. Women who go through menopause often gain weight. Yeah, I hear you. And the increased stress on the joint may explain the rise in osteoarthritis seen among women after age 55. So as well as it's being more in arthritis being more in women because of the childbirth and because of the shape of our tendon and all the rest of it, also going through that menopause. That's why sometimes some women have a problem or develop arthritis when they're going through menopause. In answer to that question, so I thought I'll deal with these questions first before we can go into the food. So women, you can see that we are more prone to these things, so we have to be more careful. If we are overweight, we try and lose some weight. Thank you. Remember, there's a disclaimer on my description saying that I just give basic ideas of knowledge or I have of these things. When you have any issues and that is really serious, or you need to make sure it's investigated, make sure you see your doctor. Okay then, goodbye and God bless.